I'm Stepheni Bourov, and I'm the Director of Nursing. I'm from the Chicago suburbs. I've lived in a bunch of the suburbs in the area, so I'm born and raised Chicagoan girl. I went to Chamberlain College of Nursing, which is Chamberlain University, I think now. I got my bachelor's degree and always thought I wanted to be an emergency room nurse and did that, but I found my passion in substance use disorder and mental health. I worked as correctional nurse for a while. I worked in substance use, and this is what has been my passion. I have a lot of alcoholism and stuff in the family. I've lost some friends to alcoholism and addiction and have had my own little battles here and there. So I can definitely relate to a lot of people in this population. As Director of Nursing, I oversee the inpatient nursing department. I make sure that the staff has all the equipment that they need, the medications that they need. I help educate them and teach them the different assessments that's entailed with, detoxing patients. I also, go through and I do all the auditing and ordering for the department. One of the biggest things for me is I love to make sure that my nurses are educated. I have a lot of nurses that come in and they've never worked in this environment, and my passion is educating them because they want to be here and they want to take care of you. And so I'm all about breaking that stigma and educating because everybody knows somebody that is struggling with this. The nursing department collaborates very closely with the providers, the nurse practitioners, the physician assistant, because we work with the patients every single day. We're with them 24/7 on the floor, so we're able to give a lot of information to the providers that they might not get on their 30-minute visit with them. We also collaborate with the clinical department and the therapists to kind of give them a heads up on how their anxiety and how their cravings have been going and stuff like that. So we collaborate with them. If we see things that are out of the normal as far as their medical conditions or stuff, we can report that off to providers as well. So we aren't just treating their mental illness or just not treating their substance use disorder. We also treat a lot of diabetes and hypertension and all the other medical stuff here too. So we do a little bit of everything. When you're in our detox program, we're going to help you rid the body of all the toxins in a safe way and keep you as comfortable as we can by the various medications that we have. If you have a symptom, we probably have something to treat it. So I always make sure the patients know that. Just don't sit in bed and be miserable. Come to us, tell us how you're feeling so we can take care of you and get you feeling better. So when a patient's being discharged, the nursing department makes sure that the patient has enough medications to go home with, that we tell them where their refills may be sent to their home pharmacies, that they don't have any questions about what they take, why they take it, when they need to take it. We give them all that education, what the medication's for. We make sure that they understand the importance of following up with your primary care and their psychiatry and stuff to get their refills, and just answer any questions that they may have as far as their nursing portion of their care. And again, collaborating with the providers, making sure they know about any referrals that they may be recommending to them. If you're nervous about coming in because you're going to feel like garbage, you're going to be miserable, and you don't want to go through it, just take that step, come in, because we will help you through it. We will keep you comfortable, and you won't be alone. And you're going to thank yourself, because the change that you'll feel in just a couple days is amazing. And you're going to thank yourself for it.